are about 3 times more likely to die from pregnancy. What are the root causes? Racial and ethnic bias in any It is horrifying African Americans patients compared to white patients. In a controlled study.
Thank you guys for listening. This is episode 22 with the renowned Nancy Wayne. These are a few of my favorite highlights from the episode in which she talks about healthcare racial biases.
It is highly likely that everything that happens to a person from birth through childhood into adulthood will have an impact on everything. Everything about that person's health and in health trajectory. And so much of it is related to stress and trauma that begins in the womb, in utero, before you're even born. And it's really amazing. I could give an entire, course on the impact of stress on the body, on the different organ systems, on health and disease. And there are courses on that. It's a huge topic. And if you haven't already had somebody on your show that is an expert on the impact of stress on health and disease, that would be a really juicy topic to get into. And at the very least, higher maternal mortality of Black women and indigenous women points to systemic racism that pervades our medical system. Both women and Black people are undervalued in US society. So if you are a Black woman, you have to contend with the combination of sexism and racism in every facet of your life. And that extends to our healthcare system. And it's the double whammy of stress, right? And that's going to impact a Black woman's body differently than it will impact a Black man's body or a white woman's body, if we look at all the intersections there.
Wow.
The pregnancy-related death rate for Black women with at least a college degree was 5 times higher than that of their white counterparts. According to the CDC, Black women, American Indian women, and Alaska Native women are about 3 times more likely to die from pregnancy-related causes than white women. And this disparity increases with the age of the woman. You can judge a nation and how successful it will be based on how it treats its women and its girls. So, the more leaders that we can get on board, the better, because they will be, they hold the purse strings. They can make a difference. I have not seen which hospitals are putting better protocols and procedures in place. A critical part of fixing this problem is for hospitals and clinics to track patient diagnoses, patient treatment, and outcomes as a function of race and ethnicity, and then quickly determine if there is racial and ethnic bias in any of those. We need to turn awareness into action. We need to turn awareness into action. It's highly likely that it's happening with every single organ system. In other words, the greater the implicit bias, the less likely that life-saving thrombolytic treatment would be recommended for Black patients, and more likely that it would be recommended for white patients.
Okay, so that wraps up all of my favorite highlights of episode 22 with the renowned Nancy Wayne. If you haven't listened, you can visit agendausnow.com where you can find all of my podcasts there.